In this video, we're going to cover key things that you need to know about pelvic organ prolapses, which is where one or more of the organs in the pelvis, such as the uterus, bowel, or bladder, slip down from their normal position and bulge into the vagina. We're going to be covering the following information, which is split into sections and is ever time-stamped for you to navigate your way around the video. So first of all, what causes a pelvic organ prolapse? Well, a pelvic organ prolapse occurs when the pelvic floor, which is a group of muscles and tissues that normally supports the pelvic organs, becomes weakened and can't hold the organs in place. Now, some scenarios that might lead to this are childbirth, menopause, being overweight, lifting heavy objects repeatedly, and long-term constipation, or a health condition that causes you to strain. Now, there are four main types of prolapses. The first is the bladder bulging into the front wall of the vagina. This is known as an anterior prolapse. The second is the womb bulging or hanging down into the vagina. This is called a uterine prolapse. The third is the top of the vagina sagging down. This happens to some women after they've had surgery to remove their womb. And the fourth is the bowel bulging forward into the back wall of the vagina. This is called a posterior wall prolapse. Now, it's important to note that it's possible to have more than one of these types of prolapses at the same time, and the severity of the prolapse will be graded on a scale from 1 to 4. So what are the symptoms that might indicate you might have a prolapse? Well, there are several different symptoms that a woman could have, and these include the feeling of heaviness around your lower tummy and genitals. You may also experience a dragging discomfort inside your vagina. You may feel like there's something coming down into your vagina. For example, it might feel like you're sitting on a small ball. You may also feel or see a bulge or lump coming out of the vagina, and you may also notice discomfort or numbness during sex. Some ladies describe problems peeing, such as feeling like your bladder's not emptying fully or needing to go to the toilet more often, or incontinence. This is where you can't control when you go to the toilet. Now, it's also possible to have no symptoms and for the condition to be discovered on a routine examination. If you believe that you've got one of these symptoms or more, then you should schedule an appointment with your health professional. Now, during this appointment, your doctor or the specialist nurse are going to ask you if they can do an internal pelvic examination. Now, this is going to require you to undress from the waist down and lie back on an examination bed. The health professional will then feel for any lumps in your pelvic area, and they'll also feel inside your vagina. They may insert a speculum into your vagina. This is a smooth plastic instrument which looks like this, so that they can better see and assess the situation. Now, this procedure might be slightly uncomfortable, but it shouldn't be painful. You can ask for the examination to be done by a female doctor or nurse, and if you like, you can bring someone you trust along with you for support. Now, if you're alone, you're also more than entitled to ask for a chaperone if this will make you feel more comfortable. This is a trained professional who can be present in the same room at the same time to make sure that you're comfortable with the procedure being carried out. So let's move on now and discuss different treatment options. Now, if you have a mild prolapse, you might not require any medical treatment, and the situation may resolve from some lifestyle changes, such as losing weight, avoiding heavy lifting, or activities that cause you to strain, or treating constipation if this is the underlying reason for your prolapse. This is really important because often constipation and straining or pushing down on the toilet is the reason for many prolapses. It may also be helpful to do pelvic floor exercises to strengthen the muscles in the area, and I've included a link in the description box of a video of how to do pelvic floor exercises, as well as descriptions from trusted websites. Most of these you can do at home in your own time. Now, if the prolapse is more serious or it's a more severe grade, then your health provider may advise several different treatment options. These can include hormone treatment, vaginal pessaries, or even surgery. Now, hormone therapy, which would include a treatment of estrogen, may be advised by your health provider if you've got a mild prolapse and you've been through the menopause. The treatment can be a cream that you can apply inside. Now, this treatment can be a cream that you can apply to your vagina, a tablet that you can insert into your vagina, or an estrogen-releasing vaginal ring. Now, this treatment option isn't always suitable for everyone, and so a discussion with your doctor before starting this would be strongly advised. If you have a moderate to severe prolapse and you're considering getting pregnant in the future and you don't wish to have surgery, you could discuss vaginal pessaries treatment with your GP. Vaginal pessaries are a device made of latex or silicone that's inserted into the vagina and left in place to support the vaginal walls and pelvic organs. They come in different shapes and sizes depending on your needs, and they should be removed, cleaned, and replaced regularly. Now, there are some potentially mild side effects to using vaginal pessaries, and these include unpleasant smelling vaginal discharge, some irritation and sores inside the vagina, as well as bleeding, stress incontinence, which means you lose control of your bladder, for example, when you cough, a urinary tract infection or water infection, and sometimes interference with sex. But most women can have sex without any problems. Now, these side effects can usually be treated. If you do have a severe prolapse and other treatment options have been ineffective, so for example, you've tried a pessary, you've tried doing the pelvic floor exercises and they don't work, then you may wish to consider a surgical procedure. Now, one surgical option is a surgical repair where your doctor uses stitches to make the existing tissue stronger or to lift and support the pelvic organs. This type of procedure is done under a general anesthetic, so you'd be asleep during the procedure. The recovery time after the operation is usually 6 to 12 weeks, and as ever, surgery does come with risks, so you would have to weigh up the risks and benefits of surgery with all of the different factors that are interplaying in your life to make the right decision for you, and your doctor can help you do this. Now, if you would like to have children in the future and you do have a prolapse, then your doctor may advise you to wait until you've finished having all of the children you wish to have before engaging in something like a surgical repair, and that's because the prolapse can recur or happen again even if you've had a repair in the past. Now, in terms of if you're no longer wanting to have children and you've been through the menopause, then another surgical option might be having a hysterectomy. This is the surgical removal of the womb. This can help to relieve pressure on the walls of the vagina and reduce the chances of future prolapses. The standard recovery time after a hysterectomy is going to vary from women to women, but usually it's 6 to 12 weeks. Occasionally, an operation that closes part or all of the vagina may be an option. Now, this treatment is only offered to women who've got advanced prolapses when other treatments haven't worked and they're sure they don't want to have children again in the future. Now, you may have heard of some women being offered mesh treatments, but some women have had serious complications following this procedure, including long-lasting pain, permanent nerve damage, incontinence, constipation, sexual problems, and mesh exposure through vaginal tissues, and occasionally injury to nearby organs such as the bladder or bowel. Now, your doctor should discuss all risks and possible complications of the various types of surgeries with you before you decide if one of these surgical options is right for you. If you've got any of the following symptoms after your surgery, then you'll need to let your surgeon or your doctor know as soon as possible. So these could be things like a high temperature, severe pain in your tummy, heavy vaginal bleeding, a stinging or burning sensation when you pee, or abnormal vaginal discharge, because these may be signs of an infection. You should also be offered a checkup 6 months after the surgery that includes a vaginal examination. Now, one common question that comes up is whether or not you can have sexual intercourse with a prolapse, and if intercourse will actually worsen the condition. So research and clinical evidence shows that sexual intercourse shouldn't exacerbate your prolapse, and in fact, if you have a uterine prolapse, intercourse may actually push the cervix to sit higher within the vagina. Many women can continue to have normal intercourse despite having a mild or moderate vaginal prolapse. However, as always, you should always listen to your own body and do what feels right, and talk to your doctor if you have any concerns. In the case of tampons, it may be possible to wear a tampon if your uterus is prolapsed, but it might lead to irritation. However, you shouldn't use a tampon as a solution for incontinence caused by a prolapse. If you've got any questions or concerns, you should always talk to your doctor.